All right. So very good afternoon to all of you. Thank you so much for joining in this afternoon for the July edition of Ivy Talks. As you all know, Ivy Talks is a monthly webinar series hosted by INS India, various chapters. So this month it is Gujarat. I am Pooja Swarup Saxena, Trainings and Scientific Education Lead, Polymed. On the behalf of INS India and Polymed, I welcome you all for this July edition. And those who are joining in for the first time, the program concept is very simple. It's an exclusive session for INS India members. Every month, there is a different topic that we take up. We invite the expertise of that particular topic to share their viewpoints, their experience on the topic. We also take live questions during the open forum time. You can share your queries, you can seek guidance, you will be getting a lot of viewpoints on a similar situation. Post that, we would be having a detailed open forum. Along with this, for today's session, we have brought in a different element which is called as a quiz. So we'll be having a live quiz also during the session, post the open forum, followed up by the closing remark from all the eminent panelists. And that is Ivy Talks for you. Yes, one important thing. This is this is being organized on Microsoft Teams webinar portal. So all the people who are attending the program might not be able to switch on your cameras or your unmute the mics. So if you have anything that you want to contribute to, you can always raise your hand. You can use the chat box. You can use the Q&A box to raise your queries, questions, comments. Also, if there is something that you want to say or you want to actually be heard of, you can always put in the chat box that the mic thing can be taken care of. So it's a cumulative session. We all are collaborating for this event. So that's it from my side. I would like to invite CEO INS India, Binu ma'am, to officially flag off the July edition. Over to you, ma'am.
Thank you, Pooja. Namaskar. Good afternoon, everyone. First of all, at the outset, let me compliment and congratulate Gujarat chapter for a fantastic topic and getting a interprofessional set of experts on the panel. We have 3 nursing experts. We've got a clinical pharmacist, Dr. Mayur, and we've got clinical microbiology, Dr. Jyoti Patankar. That's super wonderful. So I think having people from various verticals to address this unique topic of administration and stewardship of antibiotics is such a wonderful thought. So congratulations, Gujarat chapter. I, on behalf of the Governing Council of Infusion Nursing Society, welcome all the delegates, and I can see the numbers going up every second. Usually these webinars have 300 to 400 people by the time we are able to wrap up. And today you also have a live quiz. And since it is in Gujarat, Pooja, the first 3 winners of the live quiz should be invited to the conference and should be rewarded in the conference. Why I'm saying that? Because we are hosting our annual conference, the 14th annual conference in the beautiful state of Gujarat in the city of Ahmedabad. And we look forward to meeting many of you, and we intend to have nearly 2,000 people on a hybrid mode in person and online on YouTube during the conference. Infusion Nursing Society India is just about 16 years old. We completed 16 years in the month of, we would complete this year in December. We came up with like-minded nursing leaders for this wonderful thought of elevating nursing competencies to improve patient safety, excellence in care, as well as patient experience. All of us understand that every single nurse has to do the first procedure, and the most common one is inserting a IV cannula, a peripheral line, because that is what is needed right at the moment a patient enters the ER or when a patient is hospitalized in any department. Today is a time of intravenous administration of drugs. For everything, there is an IV line required. So if that is the case, which means every single nurse should be trained well, should know the right policies and protocols, should be certified IV cannulation nurse to start with, and later on move into other vascular devices like managing a central line, arterial line, midline catheters, blood transfusion, PIC line, chemoport. You'll be glad to know INS India takes care of all of these knowledge-based information, providing global standards for vascular access device management. And also, we are into hands-on trainings. In fact, Gujarat has been conducting skillathons and hands-on workshops very regularly. And because the conference is in Ahmedabad, every month we are hosting multiple skillathons. Thank you, Sharmishta, for taking the lead. Sharmishta is our chair for Gujarat, and Ms. Sutapa is the co-chair. We also have a scientific manager and a general secretary for the state. You'll be glad to know we've got 20 state chapters, which are led by officials in every state. We've got a general, Ulas is also one of our state officials. So we have a governing council for decision making. We've got a general council. We've got state chapter leaders. And we've got INS knowledge partners with us. We've got 3M and BD as our platinum partner. We've got Polymed and Bebron as our associate knowledge partner. IV webinar is a very, IV talks rather, is a very look forward topic. Every month it is being planned, and this is an initiative by Polymed along with INS. Thank you, Pooja and the team Polymed for all the initiatives on elevating nursing competencies. IV Talks right now is only accessible to the INS members. I would urge more and more nurses, including students, to become members to get the benefit of all the INS initiatives. We do quality improvement projects, we do leadership summit, we do various modules for critical care. We've got a collaboration with Operating Room Nursing Society. So you name it and we have it. It's a not-for-profit organization. We do a lot of things which are complementary, and sometimes there are nominal charges. So training and investing into people development is a great vision of INS. And I thank all the INS officials countrywide today. And with us, we have the president of Infusion Nursing Society, Captain Madhukari Ray, who's been a great support, a founder member right since 2010 with us. So I think we are in a good spot. I just wish to convey to the nursing leaders that you've got such wonderful platforms available for utilization, for learning, so that as professionals, you continue to grow, you continue to aspire to be better in knowledge, better in skills, and in IV cannulation, attitude, compassion, empathy, it also matters quite a lot. So congratulations, speakers, for coming together for today for such a wonderful topic, optimizing IV antibiotics. So let's hear from the experts today through a panel discussion. And thank you, Polymed, and thank you, Pooja, once again, and all the best speakers.
Thank you, ma'am.
Thank you. Thank you so much, ma'am. Madhukari ma'am, a good pep talk from your side for all of us.
For both of us, that is a regular feature. We come together and speak a few words to just make our presence and motivate everyone and let people know that, yes, we are at the back when things happen. Yeah.
Yes, of course. Good afternoon, everyone. And good afternoon, Pooja and Polymed, from bottom of our heart from INS India, because every month we wait for this IB talks to happen, because it is a very good learning platform, which gives us a lot of exchanging ideas, knowledge and skills. So definitely it has got its own pleasure to attend this, and we do get lot of nurses not only from the state who represents, but also from all other states. So that's how, with that, I must congratulate, as madam said, very true and very apt, that as we are going to have the next conference, coming conference in Ahmedabad. We are looking for this team to be very vibrant with bigger and bigger in size so that we can have a lot of, showcasing of nursing talents in every aspects of infusion therapy. And here with Sharmishta being chair, and we have Jeannie and Anita being co-chair, and we have Sutapa Chakravarti being the scientific manager of this state. And we have Dr. Ullas as General Secretary. I must congratulate all of you to take this state forward for not only with the members, also with the kind of scientific activities that you do every time. That is really praiseworthy. And with that, it is our privilege to attend and to be part of it all the time. We enjoy attending this. And I also want to thank Dr. Jyoti and Dr. Mayur for making your presence felt here. And we are really, truly honored. So without much ado, let us go ahead with the panel and with the topic straight away, because antibiotic is very important for infusion therapy, and let us learn it together.
I- Thank you. Thank you so much, ma'am. So, we would like
Thank you.
to thank you, ma'am. I would like to invite our moderator for today, and Ullas is INS chapter official, of course, Dr. Ullas Udayan. He is the CNO and hospital quality head from from Srimati Rasila Ben Sevanti Lal Shah Venus Hospital, Surat, and he would be taking care of the entire panel discussion right from the moment onwards. Ullas, over to you.
Yes, ma'am. Thank you so much, ma'am. Thank you so much. Good afternoon, everyone. So, on behalf of the Infusion Nurses Society India Gujarat chapter, it's my privilege to welcome all of you to the July edition of IV Talks. Today's panel discussion focuses on an extremely important theme: optimizing IV antibiotic therapy, where infusion practices meet stewardship. We are joined by infusion nurses, nursing leaders, healthcare professionals representing different hospitals. This gives us an excellent opportunity not only to discuss the science of IV antibiotic therapy, but also to examine how these principles can be translated into safe, standardized, and measurable nursing practice. Selecting the right antibiotic is only one part of treatment journey. The quality of care is also influenced by accuracy of specimen collection, the interpretation and the communication of laboratory findings, the appropriateness of dose, infusion methods, safe bedside administration, patient monitoring, and the competency of nurse delivering the therapy. Therefore, today's discussion will follow the complete clinical pathway from laboratory to the prescription to the infusion and finally to the system that ensure nursing competency and patient safety. This is Ullas Udayan, and it's my honor to moderate this distinguished multidisciplinary panel. So let's introduce the panelists. It's my privilege to introduce the distinguished panel. The first, Dr. Jyoti Ma'am. Dr. Jyoti Padnakar Ma'am is a clinical microbiologist and infection control officer from Sterling Diagnostics and the Sterling Hospital, Vadodara. Ma'am, welcome to the panel discussion. Mom will lead us through the topic from lab to bedside, a smarter antibiotic choice. And we are having a senior and expert clinical pharmacologist, Dr. Mayur Patel, sir. So he's one of the enthusiastic clinical pharmacologists from KD Hospital, Ahmedabad. We'll discuss the topic optimizing IV antibiotic administration, right drug and right dose, right infusion. Sir, Dr. Mayur, sir, welcome to the panel. And the third, we are having Ms. Sutapa Ma'am. Sutapa Ma'am is a very senior and expert nursing professional and nursing leader. Ma'am is a zonal nursing head of Sterling Hospital, Vadodara. Will share her insight on leading safe IV antibiotic practices. And we are having Akshay Kumar, sir. Akshay Kumar Ramesh Pai Variya, sir. Sir is the deputy nursing head from Zydus Hospital, Vadodara, and will address competency-based training for safe infusion. So, a warm welcome to all our expert panelists. Thank you for joining us for the contributing and your expertise. So, first, we can start from Dr. Jodhima. So, we will begin where an evidence-based antibiotic decision should ideally begin with a realistic, reliable diagnostic information. Dr. Jodhimam is assigned with a topic from lab to bedside, a smarter antibiotic choice? Dr. Jyoti ma'am, welcome to the discussion. The first question to you, ma'am. The accuracy of antibiotic selection is strongly influenced by the quality and timely availability of microbiological information. From specimen collection to culture reporting, what critical practices should nurses and nursing leaders standardize to ensure that laboratory findings reliably support smarter antibiotic selection? This is my first question. Along with the first question, I am dropping my second question too. So my second question to you, ma'am, once the culture and antimicrobial susceptibility result become available, how can hospitals strengthen the lab to bedside communication pathway to facilitate timely review, escalation, de-escalation, and modification of antibiotic therapy? What specific role should nurses play in closing this communication loop? Ma'am, over to you, ma'am.
Yeah. Good afternoon, everyone. Thank you, Dr. Ullas, INS India Gujarat chapter, and Polymed for inviting me for these discussions. Now coming to the question one. Here, let me share my PPT first. Now coming to the question one. You asked me the first question, that is accuracy of the influence of the quality and timely available from microbiological information, right? So you are practically in sort what I told you, I taken as a question one as a diagnostic stewardship. And if you look it into the whole program of antimicrobial stewardship program, diagnostic is one core component of the antimicrobial stewardship program. And basically it focused on the three core components. So three core components, which includes ordering of a right test for a right patient at right time. Second, it contains the performing the test by a right method. That comes at the laboratory portion. The performing the test by a right method so that the accurate results can be delivered. And third is the communicating at the right time. So timely decision can be taken so that you can take the timely decisions and the better outcome can be given. And so the nursing is ready to give the responsible care for the patient. So first of this comes as a specimen collection and handling of the patient, which is the key for the accuracy in the diagnosis. So always remember, a right sample collected at the right way will give the right result. And always remember, whenever you are collecting a sample for a microbiology testing, golden rule stands. Collect before the antibiotic started. If the patient is already on the antibiotic, then collect the sample before the next dose. And in case of emergency, yes, last, but you can give the sample at any given time. So what are the steps in giving the right sample? First, choose the right container. Right container for a microbiology has to be always sterile, clean, leak-proof, and appropriate for the specimen. What is meant by the appropriate for the specimen? I will describe in the next coming talk. Before that, whenever you take the right container, then you just remember you have a second line, that is a proper labeling and the identification. The label has to be done immediately after a collection, and it should include the patient ID, date and time of a collection, the source of the collection. And you should remember minimum 2 identifiers should be included before labeling the sample. So now coming to the selection as well as the collection techniques. So first is all the time you have to collect by a aseptic technique at all the time. For example, if you take a urine, always we tell the patients clean catch midstream urine collection, so that if the earliest if the clean sample, first sample is collected, then there will probably chances of a colonizers, and last samples will give the contamination. So always give the clean catch midstream urine sample to the laboratory. In case of the patient is catheterized, then what the nursing should do is they should give a sample collected from the soft rubber connector between the catheter and the collecting tube, which has to be sterile. The portion has to be get sterile with the 70% of 70% alcohol, and the urine has been aspirated with the sterile syringe. In the case, and then it has to be transported into the sterile container. Then if the patient is your young child or a neonate, then the suprapubic collection can be done by disinfecting the skin over the bladder, and the urine aspirate has to be done by 18 gauge spinal needles. Never collect your sample from the urine bags. That is the bottom line you have to remember. In case of a CSF collection, yes, CSF is done by the doctors, we know, but what nursing has to do a role is while giving the collecting samples, while collecting the sample, first collection of a CSF which comes has to be collected for a biochemical analysis. Second sample which is be there will be collected for the microbiology, and the third layer has to be collected for the cytological. This is a very small thing, but if you give this slight input from your side, then I think the results will be amazing. First, biochemical analysis, yes, colonizers are washed off, and the last is what the deposit is coming. That's why the cytology is important. When we are collecting the sample as a pus from the wound, skin, or a deep sepsis, then you have to take a sample for the pus or exudate. Remember, pus swabs is highly not recommended by the laboratories because it can carry a small colonizers along with the sample. So please give the sample for the pus, which will be from the depth of the wound, or the aspirate with the syringe and the needle. And whenever you are collecting the swabs, please collect the two samples, two swabs, that is one for the direct microscopy and one for the culture. In case of a sputum, there are all, when you are collecting, first remember the sample container has to have a wide mouth, so that for a patient it is easy to take out the sputum. Second thing, before collecting the sample, you should give a mouth gargles to remove the food debris from the mouth. And the patient should be instructed to take a 2 to 3 deep inhalation and then cough out deeply from the chest. So we need we don't get salivary samples, and proper mucus samples has been collected. In case of a blood collection sample has to be considered as a procedure in a ward or ICU. Please make my words that way, because a single contamination in blood sample can change a complete treatment line in the patient. So always collect a peripheral venipuncture sample with a sterile technique. And if you have a CBP line in the patients and your clinician is expecting a CRBSI or a line infection, then one sample or a one set has to be collected from the CBP line, and one line or one sample or a one set from the peripheral line. So that whenever the microbiology will analyze the report, if the positivity time difference between the CBP line and the peripheral collection line is more than 2, then yes, your line is infected. That reflects the line is infected. So labeling of every sample collected, whether it is from the periphery, whether it is from the CVP line, has to be mentioned on the blood culture bottles itself. So these are the small things which we have to remember while collecting the blood culture.
Ma'am, ma'am, one sec. Your presentation is not visible. Can share it also.
I don't understand. Now?
No, ma'am, it's not visible.
Just wait. Now?
No,
Is it okay?
no. No,
Not
ma'am, it's
visible.
still.
Is it now visible?
Now it's
Yes, ma'am, something is coming up. Yep. Ma'am, you can take it to the slide itself. And just open the presentation, it will come, ma'am.
Is that okay now?
Yes, ma'am, it has come up. Just you can just put it to full screen mode. That's it, ma'am.
Yeah.
Thank you so much.
Now coming to the transport and the storage. So whenever the sample has been collected, it has to be transported immediately and promptly to the laboratory. If there is a delay, then you can refrigerate the sample, except the CSF and the blood culture. CSF and blood culture has to store and maintain at the room temperature. But if you are collecting a sample for the viral etiology, that is viral meningitis or a viral encephalopathy, then the CSF has to be refrigerated. That is the one exception for the CSF. So whenever then coming to the special consideration is that when it's only when there is the note when the antibiotic has been given or treatment has been already given or treatment has to delayed, everything has to be noted down in the documentation, which I will coming to. Then handling to the biohazard specimen is what it's how the things are important is whenever you are collecting a sample, you are handing over to the someone and the person is going to hand it over to the another healthcare worker. So there is a chain of the healthcare workers which are involved in handling the sample. So whenever the first thing it has to be then follow the standard precautions. If required, wear a PPE and use the leak-proof packaging, and the safety of the container has to be make sure. Along with that, you can write if specifically these are important when there is a sample which is taken for a mycobacterium tuberculosis or a respiratory samples which we are carrying from one place to the another place. Also, seropositive patients. If you are if you have a seropositive samples from the seropositive, then also you have to instruct the personnel as the carrying personnel as well as the lab personals. Now coming to seventh point, that is the quality control and the documentation, is that it's how you fill the form for the microbiology. The complete request has to be there, so that you are writing a complete ID of the patient, name, age, sex, treating doctor, treating consultant. In case, why treating consultant is important, in case if that microbiology wants to discuss something with them, then they should know from where the sample is, to whom to contact. If, and another thing which have to be there is adequate labeling, I just have covered, and clinical details, so that in case of for example, I am telling you the in clinical details, if you write a community acquired pneumonia, simple diagnosis, if you have written on the prescription, then the microbiology department will completely understand, yes, now the streptococcus pneumoniae has been suspected. So they will put a one extra plate of a culture as a chocolate agar. So this is how the small things which is written on a paper can change a whole technique how to handle the sample in the laboratory. So the clinical details, if the patient is on antibiotic, you have to write if what antibiotic has been given, so that everything can be correlated when the report at the finalization state of reports. So this is how every step which I have told, from the choosing a correct sample, choosing a diagnosis, sorry, not choosing the diagnosis, is a diagnosis of the patient, then what sample has to be sent, and how it has to send, every step which has been taken for the collection of sample at the end of a nursing is important, because quality in collection of a sample is a key for the accuracy in the diagnosis.
Thank you, ma'am. Thank you for the detailed explanation on the sample collection, ma'am. Ma'am,
Yeah.
let us go to the second question. So,
Yeah.
once the culture and antimicrobial susceptibility results become available, how can hospitals strengthen the lab to bedside communication pathway to facilitate timely review, escalation, de-escalation, and modification of antibiotic therapy? What specific role should nurses play in closing this communication loop, ma'am?
So you are asking me how the report has to be interpreted and what nursing is going to take the action.
Yep, perfect, ma'am. Perfect.
So now what the nursing should know about the microbiology report? First thing. So whenever there is a report comes from the department and a nurse is standing with the report, what they should look it into. First is the information, that is, if whatever I am looking for is for the correct patient, correct specimen, correct the same collection date and time which I am looking at. What second thing the report is going to tell you is what is an organism identified. What is there? Whether there's a gram positive, gram negative, staphylococcus. If you don't understand gram positive, gram negative, then the staphylococcus, E. coli, Klebsiella, whatever it is. And third thing the report is going to tell you is about antibiotic susceptibility. That is, S is for the susceptibility. I isn't very tricky for the nursing, but still I'll tell you that I intermediate is always a susceptible, but the organism is going to respond when the double dose or an increased dose of the antibiotic is given. And the resistant is the patient is not going to respond. So these are the things when then again, another important thing which the nursing should look it into is the critical alert. Positive blood culture is always a critical alert for the treating clinicians. Then whenever there is an organism isolated, which are very high prevalence, that is high weightage which the organism keeps are MRSA, ESBL producing organism, if there is a carbapenemase resistant organism, if there is an VRE or where there is an candida in the blood culture, that is very important. This is how which I was talking. If day one, if your patient is having a fever, then the blood culture is collected, broad spectrum antibiotic has been already started. Everyone has been started. That is, nowadays is a piperacillin, tazobactam or a meropenem. Whatever the clinician suits as an empirical, they start. When there is a day 2, you receive the call, yes, blood culture is coming positive and gram negative is growing. On day 3, the microbiology lab will tell you what is growing in. So, and the whole sensitivity report is there. If you find there is a narrow spectrum antibiotic is susceptible to it, that is a ceftriaxone or something like that, then you inform to the physician immediately and verify the current antibiotic along with that, so that you can compare whether current antibiotic is sensitive, or if we lower down the sensitive antibiotic, it will become the patient, it can be benefited to the patient or not. If there is a modification is done as per the culture, then you have to be extra alert. Nursing has to be extra alert to know a complete monitoring. You know what the nursing is doing a TPR daily is a major clue for change in antibiotic. For changing or you are assessing the antibiotic is working or not. So the continuous monitoring and the documentation is a major impact in a patient care. So whenever we reviewed and narrow down, targeted therapy is given, I think it will be the best to reduce the adverse effect on the patient, as well as then to decrease the antimicrobial pressures. So always the culture guided reports, culture guided therapies are always a targeted therapies for the patients. So when what is I summarize this, how the nursing can help from collection of the sample, from the report to the action is like correct patients, correct specimen, correct organism identified, review the susceptibility, identified, notify to the physician. In case if we think they are ESBLs or a CRE or a VRE, so then correct to you can connect to the IPC team of your organization as well as the antimicrobial stewardship team of your organization. Then so that you can reinforce the infection prevention practices and prevention measures in that particular patients. So every actions taken by nurses is is always for the better care and better outcome. Thank you.
Thank you so much, ma'am. Thank you so much for the detailed explanation. So the key message from Dr. Jyoti ma'am is your discussion is that the nurses have an important role even before the antibiotic is administered through the correct specimen collection, prevention of contamination, timely transportation, recognition of significant results, and communication with the clinical team. Smarter antibiotic selection therefore begins with a reliable diagnostic process and a closed communication loop. So now the time we can move from Jyotimam to Dr. Mayur. We have now understood the laboratory information helps identify the most appropriate antimicrobial direction. The next question is, once an antibiotic is selected, how we can ensure that it is given at the right dose at the right interval through a right infusion method. So to guide us through this important area, I invite Dr. Mayur Patel. So, Mayur Patel sir, welcome to the panel. So, Mayur Patel sir is assigned with optimizing antibiotic administration, right drug, right dose, right infusion. So, my first question to you, sir, selecting the right antibiotic alone may not ensure the expected clinical outcome unless the dosing interval and the method of administration are optimized. How should factors such as renal function, body weight, severity, and site infection, and pharmacokinetics, pharmacodynamic, and principle guide the right dose and dosing schedule? Sir, can you please go through that, sir?
Okay, Dr. Ulas, thank you for questioning me.
Thank
Good afternoon, everyone. First of all, I would like to thank you, Infusion Nurses Society, Gujarat chapter, inviting me to this channel panel discussion. As a clinical pharmacologist, I strongly believe that successful IV antibiotics therapy is only about selecting the right antibiotics. It is equally important administered to the right dose at the right time through the right infusion method. Even the best antibiotics may fail, prepare or administer to incorrectly. Therefore, antimicrobial stewardship and infusion safety must always go hand in hand. So our question is, optimizing IV antibiotics therapy means much more than choosing the correct antibiotics. We should always follow the principle of the R, like a right patient, the right drug, the right dose, the right interval, and the right infusion, and the right duration. The first step is patient assessment. Uh, we go to through three steps. The first step is patient assessment, like renal function, liver function, age, body weight, obesity, and severity of illness directly influence the antibiotics dosing. Patient with impaired renal function require dose adjustment to prevent toxicity. Where is it? Critical ill patient with augmented renal clearance may need higher dose or prolonged infusion. Like CRRT patient, they need a more dose on the regular dose because continuous renal replacement therapy they have started. The second step is identify the site of infection because it's an important part to PKPD, pharmacokinetic and pharmacodynamic. As the second part identify the site of infection, antimicrobial must be adequate, penetrate in the infected tissue or bones that we have to select medication. And the third step is using microbiology effectively. As said, Jyoti madam said, culture should be collected before initiating antibiotics whenever possible. Thereby should be reviewed within 48 to 72 hours and de-escalation whenever appropriate. Okay, pharmacokinetic and pharmacodynamic are equally important. Like medication are uh, time dependent, concentration dependent, and AUC dependent. Time dependent medication means uh, medication required MIC level in blood optimal, like extended infusion. Um, uh, de- Time dependent antibiotics like meropenem, piperacillin, tazobactam benefit to extended infusion. Whereas is concentration dependent antibiotics like aminoglycoside is like amikacin and gentamicin require higher peak concentration. They need a higher concentration. And vancomycin require therapeutic drug monitoring, TDM. We can do. We have to check what is the concentration in bloodstream. Uh, the test we perform is called a TDM, therapeutic drug monitoring. Finally, therapy should be reviewed daily based on clinical response, inflammatory markers like renal function, culture reports with IV to oral whenever appropriate. In summary, successful antibiotics therapy depends on selecting the right dose, individualizing the dose, like uh, renal function. Uh, some patient have a hepatotoxic patient. We have to need to a child of calculation and like individualizing the dose and optimizing infusion strategy and review the therapy daily through the teamwork and involving physician, clinical pharmacologist, pharmacist, microbiologist, and nurses. Uh,
Yes, sir. Sir, you are
hmm,
well explained, sir, that a right antibiotic prescription must remain responsive to the patient's
hmm,
clinical status, renal function,
hmm,
and the infection-related factors. Sir, let
yeah.
us now move from dose selection to the actual infusion process. Sir, my question to you, sir, from an infusion safety perspective, how should hospital determine the appropriate dilution, infusion duration, and administration method of IV antibiotics, including intermittent, extended, continuous infusion? What essential precautions should nurses follow regarding the stability, compatibility, and vascular access of
Yes.
including infusion pumps and patient monitoring, sir?
Okay. This is a very good question. every hospital should establish standardized protocol for dilution. Like some antibiotics need a specific dilution, like polymyxin, they require dextrose 25%, amphotericin required dextrose 25%. So every hospital should be established standardized protocol dilution. Infusion duration, like meropenem. Meropenem require MIC level continuous infusion or extended infusion, like infusion duration and administration. And the standardized dilution chart should be specified dilution. Dilution volume is important. Infusion time, stability, and storage condition also important, because sometimes storage condition are not properly, then like not perform medication exactly they want. We have to need effect. And the hospital should choose appropriate infusion strategy, while intermediate infusion in suitable many antibiotics like beta-lactam is benefit from the extended infusion, uh, like meropenem, piperacillin. Continuous infusion may be beneficial or selected critical ill patient. Then compatibility and vascularity assessment. Compatibility we discussed, like polymyxin we need to check dextrose 5%, amphotericin require compatibility with dextrose 5%, like equivalent important to vascular assessment. What vascular assessment? Nurse should verify IV compatibility with flush line appropriate and monitor IV site for the infiltration, like phlebitis and extravasation. Some drug are extravasation, so we have to monitor that points. And infusion pump, now we are going to infusion pump. Infusion pump improve dosing accuracy during the prolonged infusion. Continuous patient monitoring help to detect the allergic reaction. Sometime we have give patient accurate dose, and we can earlier identify to allergic reaction. Then we can stop the infusion. And infusion related adverse event and drug toxicity, earlier we can identify infusion pump we started. And regular competency based on nursing training, antimicrobial stewardship round, medication safety, audit and technology such as a smart infusion pump and electronic medication administration record strengthen the safe practice. To conclude, the safe IV antibiotics therapy is about delivering the right antibiotics in the right concentration is most important. Through the right vascular access like phlebitis, extravaginal, and over the right duration with continuous monitoring and effective teamwork. Okay.
Thank you, Dr. Mayur.
Then thank you once again for this opportunity.
Yeah, sir, you explained it very clearly, sir. Your discussion reminds us that the right drug alone is not sufficient. The clinical effectiveness of
Yeah.
patient safety also depends upon the right dose, dilution, interval, infusion duration, vascular access, compatibility, and assessment and monitoring.
Yeah.
Sir, you've given a very clear explanation to my question, sir. Thank you so much, sir. Thank you so much.
Thank you. Thank you. Thank you, Dr. Ulas.
Yeah. Sir, these requirements must be translated into accessible protocol that nurses can apply confidently at the bedside. Now the time, let's see how these clinical points should be implemented in the nursing practice. So now the time to transition from the clinical side to nursing practice. We have now discussed the laboratory and pharmacological foundation of IV antibiotic therapy. However, we both must ultimately be translated into reliable bedside practice. This requires leaders, nursing leadership, standardization, and a culture in which nurses are empowered to identify, escalate concern. So now the time I invite the very reputed nursing leader, Ms. Sutaba Ma'am. So, Sutaba Ma'am, the question and the task assigned to you is leading safe IV antibiotic practices. Miss, so let's start the discussion. The first question to you, Ma'am, from the nursing leadership perspective, what essential practice should be standardized across the hospitals to ensure that the safe preparation, administration, monitoring, and documentation of IV antibiotics? Over to you, Ma'am.
Thank you, Dr. Ullas. And it is my both honor and privilege to discuss that sacrosanct subject, which is fundamental for patient safety. So before going to your answer, I would share one opinion from our participants. So I want to share my slides. Is it visible?
Not yet, ma'am.
Okay. Now it is visible, hopefully.
The screen is visible, ma'am. PPT needs to be present. Yeah. Yeah.
Yes.
Yes, ma'am, it is visible now.
Oh, no. Okay. So this is my question. I request to everyone, what common misconception among the nurses act as a barrier to their involvement in antimicrobial stewardship program? I request all participants to share their opinion in chat board. You have a 30 seconds time. Request Dr. Ullas or Pooja to check the chat board for the.
Yes.
You can respond in the chat box. What is the common misconception among nurses? Acts as a barrier to their involvement in antimicrobial stewardship programs. Options. First, option A is the assumption that all infections are caused by parasites. B, the idea that antibiotics are completely ineffective against the bacterial strains. C, the belief that stewardship is not their function because they are not prescribers. And D, the belief that hand hygiene has no impact on antibiotic resistance. Come on, guys. Mostly we are getting C in the answer, ma'am.
So the responsibility, thank you. Thank you for the altering the questions options. And absolutely, it is the answer is C. Why it is C? So you give your answer. The nurses are the play essential role for in antibiotic microbial stewardship. So what are the point we have to discuss in the essential practice? So first start with practice patient ID, patient verification. So patient identification. We all know we have to verify two identification, the patient's name and identification and ID number. Then we have to find out the allergic reaction. That allergic reaction can be a drug allergic reaction. That can be a drug food allergic reaction. You have to check the doctor advice for 5 hours, like drug dose routine times, and do not use the compromised IV medication in compromised vein. So you have to assess the IV access. And you have to also check the drug compatibility, drug fluid compatibility, and Y-site compatibility. What is Y-site compatibility? This is some medication are not compatible with along with another medication. So you have to check in Y connection what medication you can administer at a time. So this is your verification part. Now the preparation part.
Shutapa, can you just put it in the slide mode?
Yes, ma'am.
Yeah, can you put the presentation in the slide mode?
Is it okay, ma'am?
Yeah, thank you. Yeah, thank you. Thank you so much.
Yes. Now the preparation part. The preparation, it is already discussed in my previous speaker. So still I am discussing about the dilution. So nurses have a basic concept which medication has to be dissolved in what solution. That can be a manufacturer recommendation. That can be a normal saline. That can be a 5% dextrose. There is a standard dilution chart must be there in the units. Now the compatibility. Many drugs cannot be mixed with other drugs. It causes the precipitation
reduce the efficacy. There can be a catheter occlusion. There can be a drug degradation. So you have to know the drug compatibility and drug dilution properly. One good practice, that is 5 mom of injection practice, or SHASH. SHASH is saline, then the IV administration of medication, again saline. If indicated, you can give heparin. This is the main SHASH you can follow, or you can follow 5 mMOMs of IV injection. And so for this reason, we have to need the approved compatibility chart, and that should be verified by pharmacotherapeutic committee. And there should be a recommended infusion rate chart. Now the nursing stability part. In stability, we have to, some medication are photogenic, or light of exposure is not possible for them. We have to, in our daily practice, they are covering with other photosynthetic or photofabric papers to prevent from lights. So we have to know the temperature, we have to know the light exposure, the time sensitivity of the preparation, and the initial time of the preparation. The nursing responsibility is to date, time of the preparation, and the initial of the preparation. Discard the preparation if the recommendation stability period is over. So there is no compromise in that preparation. Now the administration. And most of the cases we are administered in 5 hours, and if possible, you have to follow the 10 hours. But what is the important? The first dose of administration of medication is very important, where patient is in sepsis, or you have to administer medicine. Before that, you have to check that you have collect the sample, culture sample for antibiotic. It is a very important. Most of the cases, we have to train the staff, please collect culture and then give antibiotics. So you have to take care of the things. Now the infusion rate. Nowadays, there is so much smart pump is there, and there is some electronic devices is there. Still, I am encouraging staff. The clinical experience is your electronics gadget can support in many ways, but your observation, your clinical experience is, it is your strength. So that cannot be compromised by other technical gadgets. So you have to take care of this part, and you have to create that clinical eye on administration protocol, on maintaining the during the time of administration. And in infusion rate, some of the medicine you have to give in fast. You should not give in fast, or like vancomycin. If you are giving vancomycin in fast, what happens? There is a chances of red man syndromes. And other many medication that causes a hypotension, arrhythmia, and there are vein irritation also. Like that, if you are infused meropenem, so you have to infuse meropenem through smart pump, not in a regular infusion way. Extended standard infusion protocol improve the pharmacodynamic of the selected patient. So we have to take care of that part. Now the
Your slide is
monitoring.
not moving, Sutapa. Your slide is not moving.
I have one slide.
You are in the same slide? Okay.
Yes,
But ma'am, in the same
I
slide,
have in
ma'am.
one
One
slide.
side. Yes, ma'am.
Now the monitoring part, that is, there is a monitor in clinical monitor. There can be a patient who came with the fever. You have to take care that the fever is reducing or not. Nurses are empowered on that part. Your clinical observations speak here. So you have to observe the nurses, the patient's wounds are healing or not, that the pain is deteriorating, or there is a purulent discharge are reduced or not. That you have to monitor. That is your clinical observation. And you have to monitor the ADR is there or not. And definitely you have to take care of the IV side. If there is any pain, redness, swelling, or leakage, or any extravasation or flavor release, you have to observe these things. And you have to note it down in your monitoring sheet. The post-administration monitor, one of the important aspects, you have to basic 5 vitals along with the patient's clinical observation, you have to note it down. And in that also, you have to monitor the organ function lab. Like some antibiotic increase the creatinine level. You have to observe that one also. Some are causes LFT increase. CRP can be reduced. Culture sensitivity can be changed. So you have to monitor all these things. What is the nursing red flag on that area? The nursing red flag is anaphylaxis, persistence hypotension, new confusion developed, reduced urine output, sudden rash or a blister, or seizure or respiratory distress. So you have to monitor either one of the things are present. You have to raise the alarm, speak out for the alarm. This is the most important part. And nurses are staying with the patient for 24/7. So they are the main owner of the patient custodian. Now the documents part. As usual, documents, we are documenting the drug name, route, infusion duration, and the patient's response and early sign of any anaphylactic or allergic reaction. Any adverse reaction is developed or not. And there should be a communication with the physician that should be documented in the in our chart. And another important aspect, that is patient's education. Patient education, what medication we are provided to the medication to the patient, what are the symptoms can be developed, and what preventive measure can be taken. We have to educate the patient about the antibiotics. Now the quality improvement. In that quality improvement, we are usually all the area we have the practice of audit. We can initiate an audit, but we can changes the audit process in regular in exchange of regular audit. We can do a fast dose of antibiotic compliance rate, tracking minimized or delayed dose or IV administration practice, reducing the unnecessary peripheral line changes, and training and education part. We also take a part on that, and nurses should be along with the part of the antimicrobial stewardship. These are the essential practice, in my opinion, that should be implemented in the across the area, so that nurses can get a standardized process or pathway and they can follow it. Every antibiotics dose administered safely is step towards protecting our present and preserving effectiveness of our future generation. Thank you for your question, Ullash.
Thank you, ma'am. Thank you for the detailed explanation of nursing standardization for safe antibiotic management, ma'am. Ma'am, the thing standard protocol are essential, but protocol alone cannot ensure safety unless nurses feel confident and supported in raising the concern. So related to this, ma'am, my second question: how can nursing leaders establish a strong safety culture in which nurses feel empowered to identify, question, and escalate concern related to unclear prescription, inappropriate dilution, delayed or omitted doses, incompatibility, infusion reaction, and changes in the patient clinical condition? Mom, can you please give a detailed explanation to this, mom?
See, it is a vast chapter. So minimize of that, I have created one slide for that. Just share to that. There is some leadership pillar. There is some competency focus, some nursing behavior, and clinical impact. So if there is any building nursing competency, first nurse should speak up. Nurse should speak up when the question are unclear prescription, inappropriate dilution, incompatibility or delays dose, or any untoward situation where nurses create some doubts. Nurses should speak up. That is that help in clinical impact, early clarification, and timely escalation. And where should competency focused on? That is ASBAR simulation and the communication methods. Now the IV antibiotic competency. There is a process in every hospital regularly in yearly competency or 6 months of yearly competency assessment process. But we can modify the competency in different way. We can create a mock on bedside procedure like emergency mock drill or anaphylactic situation. And there is a demonstration of the competency assessment in bedside procedure, how to give the antibiotic administration. and that should be taken by the from the staff also, and on-spot correction of the process. How to handle the smart pump, that should be in the IV antibiotic competency part. And this competency, I rather said that will create a confidence to the staff, that create a good competency of the staff. Confidence comes from the competency, and staff should know about these things. Now the clinical decision and supports, SOPs, bedside reference, compatibility charts, and other many charts we can create. And apart from that, we have to share the knowledge, that is case presentation, the incident sharing among the group. That can be in my training period also. I used to face the this type of meeting where we can discuss about the incident. That creates a great conception about the stuff. The annual competency, it is our process, but the regular competency assessment by sharing the knowledge of the case and the incident, that creates a great help for us. And the last, the just culture, which I should encourage staff to raise more and more incident reporting. Minimal observation also be report, so that they did not get any punitive action. Rather, they should recognize for raising the incidents, and then we can get the quality improvement from there. And this can be analyzed during the RCA, audits, and feedbacks and recognition. And one more important aspect that I have to share, the supervisor should be direct interact with the baseline bedside staff during their antibiotic practice. That can help hands on their practice and improve the competency levels. And that's all. For reference, I have created one competency poster chart, pathway chart, that can be helpful for the staff to understand, including these all points. So I'm sharing this one also. So we can create this type of competency pathway chart or poster, and display it into the department, so that staff should have what to focus, which to focus, and what is the nursing behavior on that area. So my conclusion in that area, it is our commitment together. We create a culture of safety where accountability and excellence, and in every decision as a protocol, and every action as a matter, and every patient is benefited. Thank you, Dr. Ullas.
So thank you so much, ma'am. So I hope even I can copy this nursing competency pathway to my organization. It's a better one even to copy, ma'am. Ma'am, thank you so much for the detailed explanation. You have emphasized that nursing leadership must create more than policies. It must create consistent practices, visible support, clear escalation pathways, and psychological safety for nurses to question anything that may compromise the patient safety. Safe IV antibiotic administration is therefore both the clinical responsibility and the leadership responsibility. Now the time we can move from a nursing leader to a nursing learning and development expert. So we are having in the panel Mr. Akshay Kumarji. So Akshay Bhai is one of the very good trainer, what I hear from others. So we are having in the panel. So once safe practice have been identified and standardized, the next responsibility is to ensure that every nurse can demonstrate them consistently. Attendance in the training program does not automatically establish competency. Competency must be observed, validated, and reassessed. To discuss how this can be achieved, I invite Akshay Bhai. So Akshay Bhai is an expert. So the question to Akshay Bhai is, what essential knowledge, technical skill, and clinical competencies should every nurse demonstrate before being authorized to independently prepare and administer IV antibiotics? Over to you, sir.
Good evening. Hope am I audible? Am I audible?
Yes, sir. You are clearly audible, sir.
Yeah. So good evening, everyone. First of all, thanks very much for making me a part of this wonderful event, and very grateful to this Infusion Nursing Society. So, Ullas bhai, as you have asked me about this particular question, that what essential knowledge, technical skills, and clinical competency a nurse should have before being authorized to independently prepare and administer IV antibiotics. So I would say this competencies should not just be demonstrated; it is to be taught. And the three important pillars of this are essential knowledge. What knowledge one must expect from a nurse when administering any IV antibiotics. So, as we know that nurses are daily administering many medications, and among them, one of them is antibiotics. So, I would say there are a few handful antibiotics routinely being administered by nurses. So, first of all, they must know about the indications and the mechanism of action in a brief, not in detail. If they are aware about the indication why this particular antibiotic is being administered, and if they know that what to expect out of this antibiotic that is being administered to this patient, would definitely help them anticipate side effects, and importantly, whether the antibiotic being administered is effective, whether the outcome is achieved or not. So that is the first thing I think that should be that should be expected under the essential knowledge. Second being the staff must know the allergies and the contraindications. Why? Because there are expected, every antibiotic would have this allergic reactions. They might not necessarily in all, but they must be aware about what if the patient exhibits the allergic reactions, so they can take appropriate interventions, and contraindications also they should be aware about. Third being, they must know the correct dose, dilution, and infusion duration. So they should take care of this part as well. Doing so, that can be it prevents underdosing, that is ineffective treatment. If it is not administered intended, if the antibiotic is not administered in a dosage requirement, the treatment will be ineffective. Second, if it is administered, diluting in more solvents, it would cause the toxicity. And importantly, principles of antimicrobial stewardship. So they should also be aware about that what antibiotic is to be given in what condition. So this all four parameters I would definitely say they must be aware about. Second being technical skills. As we know, to administer any antibiotic, we go ahead with IV cannulation. So selection and assessment of appropriate vascular access is very important, because there are certain drugs to be given through peripheral line. There are certain to be given through central line. So they must know how which IV line to be, or which pathway they should administer antibiotic through. Second, hand hygiene plays an important role, and they must follow the aseptic non-touch technique. Why? Because hand hygiene is very important, as we know that a lot of infections can be prevented by ensuring 60 to 65% of infection that we speak about can simply be reduced by ensuring that if the hands are washed properly, and a lot of blood catheter related blood infections can be prevented as well. So they must and when we talk about this and aseptic non-touch technique for administering antibiotic, they must scrub the hub for about 15 to 20 seconds. They should let it get dry, and only then they must inject. So that is the thing. Third being that accurate medication preparation and dose calculation is very important. And there had been a talk about the safe use of infusion pumps and flushing techniques. It is very important that the correct amount of dose is administered in appropriate or the intended timings would definitely help patients recover and get the outcomes intended. And proper documentation. So when we talk about the documentation in medical field, I've been, I've known this that if things which are not documented are considered as not done. Number one is that if something is given, that must be documented. Second, the following next shift staff would know that what has been administered, and importantly, things are to be documented for legal purposes. So, and third, clinical competency. When we talk about the clinical competency, before administering any medications, they must follow the medication rights. There are जैसे सुतप्पा madam ने बताया that there are 5 to 10 rights. So apart from that, what I had, I share with everyone that before administering, after having identified the right patient and followed all 5 rights, uh, before administering any medications, they must check they must have 3 checks done. Number one, before loading, before taking up the medications, they must see to it that the right antibiotic or medication is picked up. Second, before loading, they must go through that if the right patient, right drug, and everything is picked up. And before infusing. So before picking, before loading, and before administering, if any nurses go through this 3 checks, I'm sure that would prevent lot many errors from happening that we see to in day-to-day life. Second being that assess the patient in IV before, during, and after infusion. So if once you have injected the antibiotics, they must and it at an interval must check if the antibiotic is being infused, whether there are any signs of infection from the site of infection insertion, or if they have any signs of phlebitis. So they must check for all this. And while the infusion is being given, they must recognize and manage adverse reactions, extravasations, and anaphylactic reactions. If there are any, they must stop immediately. They must call up the floor MO, inform to the treating consultant, and must treat the patient symptomatically. So, these are the 3 things, if any nurses follows, would definitely help patients achieve better outcome.
Sir, thank you for the detailed description, sir. Sir, you have identified what a competent infusion nurse should know and be able to demonstrate. Sir, your words was too catchy. Competency must be taught, not just
Yes,
demonstrate. Sir,
yes.
our next concern is how the nursing leaders can build a system that validate and sustains these competency over time. The specific question, how can nursing leaders design and sustain competency-based infusion training program that goes beyond the classroom education, includes simulation, supervised clinical practice, written demonstration, competency validation, periodic reassessment, and learning from audits, incidents, and near misses. Over to you, sir.
Thank you so much, Ullas bhai. Now, as we know that we have a lot of attrition and there is a lot of in and out of nurses happening in today's trend. So there are many who checks in the system, and we must teach them if what is expected out of it. And when we talk about administering any antibiotics, they must be very competent enough. First of all, second, competency-based education should be a continuous process, not a one-time training program. So we must have this programs being conducted at an interval to ensure that whosoever is dealing with the patients, whosoever is treating the patients, are competent enough to administer not only routine medications but the antibiotics as well. First being the classroom education. So there is a focused training. We have in-house training happening for those who checks in the system. And we must teach them when they administer antibiotics, what is expected out of them. As I've said that, they must have essential knowledge. So all those things they must be aware about. If antibiotic is being given, indication, contraindications, mechanism of action, and at least the side effects of the drug. So by having this classroom education before placing them, in the patient care area would, build the required clinical knowledge, before we place them in the patient, care area. Second, being the trend is not so famous, but simulation based training, as Sutapa ma'am was talking about, that simulation based training can be given to the nurses. And so that would help any nurses to know if what to do when something like anaphylactic reaction happens. So that a kind of mock drill or kind of simulation based training will help nurses understand that we should act upon in such a manner if any uneventful eventful thing happens with the patient. Third being, we must not let them work independently unless they are competent enough, or competent enough to administer antibiotics to them. So we must they must be supervised. And to do so, we have, a kind of preceptorship program wherein they are they are oriented about the floor, and then they are put under they are given one or two patients under observation or supervision. And once they find that they can independently administer any antibiotics or any medications, will help many errors from happening. So supervised practice, what it does, it bridges the gap between uh, the thing what they've learned during their program of studies, and the real life scenarios when they are going to directly care for the patients. Then periodic reassessment. Very importantly, we must assess them, not only those who have inducted newly, but those who have been working for long. So just to see if the skill have been faded up with the time or not. So that actually gives us an opportunity to understand whether they are still competent enough, or do they require need-based training, do they require refresher training. So that will help us understand this. So that should be done. Competence, we have a system that we do competency assessment at the time of joining, after 6 months, 1 year, and thenceforth every yearly it is being done. So that is that practice would help us cater, or provide better care to our patients. And importantly, audits, incidents, and near misses. So continuous quality improvement projects are to be carried out in the hospital, and that is to be done through the incidents that have been reported. So that will give an insight for any nurses to understand that what to take care if such a thing happens to anyone. Or so doing all this, I'm sure a strong team will be built, and what is intended will be taken care of.
Thank you, Akshay Bhai. Thank you for the detailed description. Your discussion reinforces that competency should never be assumed based only on qualification, experience, or attendance at the training. Safe infusion requires structured education, observation, supervised performance, written demonstration, formal validation,
I'm so
and
sorry.
periodic assessment. And thank
Yes.
you so much. So hereby we completed the topic from each of the panelists. We have now examined the IV antibiotic pathway from reliability of microbiological evidence through dose and infusion optimization to safe nursing leadership and competency validation. So here we can go for the final takeaway before the Q&A section. So as we approach the conclusion of this valuable discussion, I request each panelist to share one final takeaway in approximately 30 seconds. So we can start from Dr. Jyoti, ma'am. Ma'am,
Yeah.
can you brief the final takeaway in 30 seconds, ma'am?
From my side,
Yes, ma'am.
every correctly collected specimen is an opportunity to replace the empirical therapy with a targeted therapy. And only the nurses can make that transition possible.
Perfect, yes, ma'am. Perfect, yes, ma'am. Ma'am, the next to Dr. Mayu, sir. Dr. Mayu.
Yeah,
So,
thank you.
what's your take?
Yeah. Antimicrobial stewardship is not only about choosing the antibiotics wisely, it is about ensuring the every prepared correctly, administered safely, monitored carefully, and reviewed regularly. When infusion practice meets the stewardship, patient receives safer, more effective, evidence-based antibiotics therapy. Yeah, this is from
Super,
my side.
super, superb, sir. Sir, mom,
Thank you.
one of the respected mom, my mentor, Sutapa mom. So, what's your takeaway, mom?
See, in my case, focus in your clinical strength. Your strength is your knowledge and empowerment.
Perfect.
Wow.
Wow, super. Then, Akshay, sir, it's your quote.
So as I have said earlier as well that the competency based you know competency is not to be just demonstrated, it is to be taught. It is not just to be taught, it is to be demonstrated. And second being that the ongoing training must happen everywhere, just to keep them updated, just to keep them skilled all the time. So quality is all about it is not it is as we have been telling everywhere that quality is not a destination, it is a journey. So I'm sure if that is taken care, we'll have better nurses to provide good care to our patients.
So, perfect. Thank you, sir. Thank you. So, thank you. These four recommendations give our participant clear action that can be taken back to their respective organization. So, today discussion has demonstrated that IV antibiotic safety is not an isolated medication administration task. It is a connected clinical pathway. It begins with the appropriate specimen collection and reliable microbiome. It continues through the selection of right antibiotic, dose interval, and infusion strategy. It depends on the safe nursing preparation, administration, monitoring, and documentation, and even escalation. Finally, it must be sustained through visible nursing leadership, competency validation, audit, feedback, and continuous improvement. The central message from today's panel is very clear. Antimicrobial stewardship does not end when an antibiotic is prescribed. It continues until the medication is correctly prepared, safely infused, appropriately monitored, and clinically reviewed. Nursing professionals are not merely the final link in this pathway. They are active contributors to diagnostic stewardship, medication safety, patient monitoring, communication, and quality improvement. So I hope it's the time. Puja Mom is eagerly waiting to get a handover. So on behalf of Infusion Nurses Society Gujarat chapter, I express my sincere gratitude to all our distinguished panelists, Dr. Jyoti Ma'am, Dr. Mayur Sir, Dr. Ms. Sutapa Ma'am, and Akshay Bhai. Thank you for sharing your knowledge, practice, experience, and valuable recommendations. I also thank INS leadership and especially Colonel Vinu Sharma Ma'am and the INS Gujarat team and organizing team and technical support team and participants who joined us from the different healthcare organizations. I hope today's discussion encourages every participating nursing leader to review at least one aspect of IV antibiotic practice with their organization. Even I am just copying the pathway that Sutapa Mom shared. Even I also copied something from this panel, whether related to specimen quality, infusion protocols, or nursing empowerment, the competency validation, the nurses plays a very, very, very important role, though we are in the silent zone. Let us continue working together to ensure that every IV antibiotic is delivered with the right evidence, the right technique, and the right level of professional accountability. The value of right antibiotic can only be realized when laboratory evidence, pharmacological optimization, safe nursing practice, and validated competency work together. So over to you, Mom. Pooja, Mom.
Wow, thank you. Thank you so much, Ullas. Very, very insightful panel discussion. I think we have covered all the aspects and pretty much we have got a lot of good thumbs ups and a lot of good comments already we are getting in the DM. So before proceeding for the quiz, thank you to all the panelists. I would just request the panelists to stay for a little while before proceeding for the quiz. There are a few questions which are there as a part of our ritual of the open forum. So we have a few questions. Two are there in the chat box and two I have received in DM. So we'll start with the chat box questions first. So there is a question on how, that is for Sutapa ma'am, they've mentioned that how drug compatibility is essential for antibiotic stewardship. That is for Sutapa ma'am.
It is a key component of antimicrobial stewardship because if effective antibiotic can fail, then there is a mixed or administration directly to hamper the compatibility charges. Like if you mix with another solution, there is any wise side compatibility, incompatibility is there. You are not flushing the lines properly, then also can create a incompatibility. There is a many aspect is there. If you want to share, I can share personally. Okay.
Thank you. Thank you so much, ma'am. And I think that's the continuation itself, the nursing responsibilities in preventing incompatibility, if I'm reading it correctly.
I can share personally to you. You can.
That's perfectly fine, ma'am. And this is important for all the audience who are there right now. If you are an INS India member, you would be getting an email with the key insights and the key learnings from today's session. So it is exclusively for the INS India members. You'll be getting all the key insights, whichever the speakers have taken up, you'll be getting on an email. All of you would have got the email from INS India for the invite. From this edition onwards, we are starting to send the insights as well, the key takeaways from the session. There is one more question. In fact, there are two, but let me try to combine them. There is a question for Jyoti ma'am, which is there in the chat box, ma'am. It is how can a nurse help, or how nurses can help to reduce the contamination in the blood culture samples?
And the very first, while I was explaining my collection of a sample, I have said a one statement that consider blood collection as doing a minor procedure. So you disinfect the skin as you are preparing a part for a minor procedure. So that is the biggest help to decrease the colonization of a sample.
Thank you, ma'am. There is one question also. I've got it in bits and pieces. It's a case scenario, ma'am. I'll just read it out. Maybe 1 second. Yes. So it's like a patient with suspected sepsis is due for antibiotics, but the blood culture have not yet been collected. What should the nurse do?
Preferably whenever there is a due for the antibiotic, but the thing always start big. The initial is also gold as a golden rule. You collect at the first step. Okay, where you have not started any antibiotic, you collect the sample. But if the patient is already on antibiotic, then you collect the sample whenever the second dose is due. Before the giving a second dose, you collect the blood culture.
I guess the answer is there. This question was from Kerala. Okay, I would like to we're just running out of time. There are around 7-8 questions more, ma'am. So I will send this question to all the panelists, and probably we can get the answers. Will that work, ma'am? Because it's already 4:39, and the quiz is also in there. So Thank you. Thank you so much for taking up the question to all the panelists. I would like to invite now my friend and colleague, Ms. Sharanya from Coimbatore. She's a senior clinical specialist. She is based out of Tamil Nadu, and she's an ICN with above 20 years of experience. And I would like to hand it over to Sharanya to take up the quiz form from here. Over to you, dear.
Thank you, Vijay ma'am, and a warm welcome to all the panelists and all the participants. Thank you for giving this opportunity. Here I'm going to conduct a small quiz for all the participants here. It's a simple questions only regarding this antimicrobial stewardships, everything, resistance, everything. Just only 5 questions. I will post a QR code in the chat box, and also I will post a link. You can scan the QR code, or else you can click the link also. Okay, 1 second. I posted the QR code, and one second.
Everybody, please be attentive on your chat box. Sharanya is posting in the chat box only. There. Okay, so you can scan this one, or she'll be also posting a link in here.
Yeah, I posted the link also.
Yes. So you have got the link
Both,
also in the chat box.
Once joining, please enter your name. Once joining, please enter your name there. In case your hospital name also there, it's very useful to us. Please enter your name and hospital name. Once everyone has been joined, then only I will start the quiz.
So
I
once
have
you're
to-
joined, just give a thumbs up, okay, in the chat box from your panel itself.
Okay, 17 players are ready. I'm expecting more players.
We are 100 plus in here, guys. Come on.
Join, guys. Only 5 questions.
Yes, only 5 questions. This is important. Only 5 questions.
20 players, 22, 23. Yeah, it's coming up.
Picking up.
Picking up. No, it's 22 again.
Oh.
Once everyone join, then only I can start the quiz. So all of you requested to join in fast.
Fast. Come on.
27 only. Expecting more participants. Please join in.
So we'll do fastest finger first, Sharanya. Once the starting 50, we will start.
Yeah,
Yes?
yeah, sure, ma'am. Sure, ma'am.
Who are the lucky 50 people?
We reached 30.
Great. There's a lot of rain happening in Gujarat right now. Maybe some network problem might be hampering a little bit in their assumption.
Yeah. Maybe.
Kindly share the link again. Akshay is asking.
Need the link, ma'am?
Yeah, I'll just post it again. No problem.
Okay.
Okay. So Akshay, I posted back in the chat itself. You can take it from there.
Some people are again joining in for the discussion. I have posted a QR code and also a link. Both are same only. If you want to scan the QR link, you can scan it, or if you want to click the link, you can click the link. It lead to the quiz competition. Once 50 members above are joined, we can start the quiz.
Okay. So Akshay, now you are able to join in. You can just put a thumbs up.
Ma'am, my screen is visible?
Yes, it's about to be visible. It's just okay. Pavitra is not able to join, Sharanya. How do we help her?
Once again log out and again try to log in.
Yes.
Maybe her network is not supporting her.
Maybe it could be the network thing. So
Yeah.
Tushar, I've shared the link again in the group. You can share it with the team members. How many are there? 36 players.
36. Yeah.
Sharanya, you from your side also share the QR and link again. I think that
Yeah,
would be
sure,
helpful.
sure. And in my screen also it is visible. The QR code is visible. I will,
Yes.
and the link also visible. I will share the link again. Okay.
Yep. That would be helpful.
I share the link again. And
This
yeah,
is the link again. Those who have joined little late or missed out, you can share it from there. 36, okay. 37, quickly. 38, 30, wapas 37. Hey guys, come on. At least 50 we need. 40, come on.
QR code also again I shared in the chat box.
Right. 41. Quickly.
Mm.
42, 43, 42.
It's oscillating. Again 41.
Yeah, it's oscillating.
Ayyo, it's reducing.
No.
10 more people. Don't
Oh,
get
no.
down.
All right, I think we can start now. I don't know. Maybe the patients might be losing in there. Shall we start?
Okay, yeah, of course, ma'am.
All right.
Okay, everyone, I'm going to start the quiz. Please answer it as soon as possible. Shall I start, ma'am?
Yes, you can start.
Okay. 40 players are there. I'm starting, okay?
Right.
Okay.
The faster you answer, the faster you will get, the more numbers you will get, okay?
Okay, the first question is antimicrobial resistant is, and the options are given below. The ability of pathogens to multiply under difficult circumstance, the ability of pathogen to multiply in healthcare environment, the ability of pathogen to grow in the presence of a drug that would normally kill them, the ability of pathogen to overcome the human host immune defense. Only 23. Okay, 24 answer, 26, 27, 28, 40.
Yes,
Okay.
come on.
Come on. It's getting late. Okay. Shall we
All
see the
right.
leaderboard? The first
Yeah.
correct answer is the C. And see the leaderboard. And this is the points scored by the participants.
So who has got the highest in this round?
Vaidehi Sadia.
Okay, Vaidehi.
Vaidehi.
So good clap
Yeah.
for Vaidehi.
Okay,
All right.
super. Great start. Okay, shall we go move for the next one?
Yes.
Yeah. The next question. Again, 41 players are there. Okay. Antimicrobial resistance is, the second question is antimicrobial resistance results in better outcome for patients, has decreased cost of treatment for common infections, is not a common, it's not a common problem worldwide, makes available antimicrobial less effective and infections more difficult to treat.
This is
I hope
interesting.
everyone will know the answer. Know the correct answer.
35, 36, 37, 38.
39. Okay, 40 answered then. Okay, shall we see the leaderboard?
Yes.
Yeah. Let's see who is in the first thing. Again, Sinoj is in the first place. Okay.
Sinoj.
Okay. We will move on to the third question.
Okay, shall we consider Vaidehi still? Sinoj's polymer team.
Yeah, of course. If Sinoj is okay, I'm okay. Okay, we'll start the quiz. The third question. Antimicrobial stewardship program. And the first one, aim to improve patient outcome, raise awareness of the problem of antimicrobial resistance, encourage rational usage of antimicrobial, all the above. Of course, this one also answered correct by everyone. I know that.
Right.
The great tie, it will happen great tie, I think so.
Right.
Super, everyone has voted. Let's see the leaderboard.
This is the first question everybody has voted, huh?
And this time, who leads the board? Again, Sinoj is leading. Sinoj and Vaidehi has a great tie, I
Right.
think.
Good competition.
Good. Yeah. And the fourth question.
And although Shinoj is from Polymer team, but Shinoj does not know the answers. Okay, we have not disclosed any answers to him.
Yeah.
Which
Only
is
I know
fair.
the answer.
Only
I know
Sharanya
the
knows.
answer. Okay. And then the fourth question.
Vaidehi is from Venus, so that should be considered.
Oh, super.
Okay, the fourth question is the most important reason to implement antimicrobial stewardship is to conserve the effectiveness of antimicrobial for the future, to save healthcare facilities money, to limit the number of antimicrobial that doctors can prescribe, to avoid patients developing side effects from antimicrobial. Little bit tricky question this is.
Yes.
Let's see who wins the board, who is leading in the board after this question.
Yes. This may turn little bit things.
Yeah.
Yes.
Okay, we see the leaderboard. Yeah. Okay. Same competition going on.
Same only, yes.
Okay, we are coming to the end. The last
Dr.
question.
Gurpreet is also catching up. Yes.
Yeah. The fifth question, last one.
Last question, guys.
They attended. Anything can happen now. The ideal antimicrobial stewardship committee should be made up of clinician, doctors and nurse practitioners, and the data manager, hospital management, a microbiologist and a senior doctor, pharmacy, the IPC practitioner and a senior doctor, a manager, clinician pharmacist, microbiologist, data manager, and IPC practitioner. Let's see, this is also a little bit tricky only.
Yes, and this could be the decider as well.
Yeah, of course. Okay. Okay, everyone has answered. Let's see the leaderboard now. This is the final leaderboard. Let's all of you ready to see who is the winner?
Yay.
Shall we see the board? Okay, cross hands. We are going to see the board.
Okay, let's see. No. Some
Again, Sinoj is in the first top, and then Vaihegi and Dr. Gurpreet. And now we have to decide who's the first, second, and third. And big clap to Sinoj also. Good try, Sinoj.
Yes, Sinoj, good try.
डॉक्टर गुरप्रीत कहाँ से है?
Yes, Dr. Gurpreet is from where?
Please share your hospital address and where you are from in the chat box.
Yes, Dr. Gurpreet, we'll request you to please put your details in the chat box also. Many congrats to all the winners.
So I hope 2 lakhs is the prize money, right, ma'am?
Wow, Ullas.
Very nice.
Sorry to disappoint. But I'm sure there are going to be gifts over there for the winners.
Ma'am, Dr. Gurpreet is clinical pharmacologist at Batra Hospital and Medical Research Center.
Oh, he's from Delhi.
Yeah.
Super. We got all India winners in that case.
So taking the polymer guy apart, so Venus is in the first prize.
Yeah,
of course. Venus is in the first place.
So let's clap for Venus.
Okay,
yeah.
And this right. Who's the third one, Sharanya, after Mr. Gurpreet, Dr. Gurpreet? Can we get to know the name?
1 second, ma'am. I'll check 1 second.
Yes.
I don't know. He or she didn't mention her name. It is Tinglicious. This name is taken by the this app itself. We have to type the name. Otherwise, it will give a nickname to us. It is
Okay.
coming as Stinglicious. Stinglicious.
All right. So guys, this is we're getting queries in the chat box also to increase more questions in Ivy Talks from next from in this quiz. So this is the first time. This was a pilot with the Gujarat chapter. We wanted to incorporate this to make you understand the topic, also to have a lot of interaction, because this is a webinar portal. Less interaction from the audience side is there. So we will essentially make it a mandatory, a part of Ivy Talk from next session onwards, and you'll be getting questions, answers, prizes, everything. Right? Thank you so much, Saranya, for helping us out. Thank you for this
My pleasure,
very
ma'am.
lovely quiz. Thank you so much.
And
And
thank
Thank
you
you
for
so
all
much,
the
ma'am. Thank you.
participants. Thank you all the participants for eagerly participating in this. And
yes,
if anyone know, if it is possible, please who's that Stinglicious?
yes, we can find out who is the
उन्होंने चैट
Yes.
Tinglicious.
उन्होंने चैट बॉक्स में शायद अपना कमेंट छोड़ा है मिस
Ah.
अनन्ना सेन फ्रॉम मणिपाल
Manipal, where? Dhanbad. Where is what is mentioned in there?
Uh, Annama Sam from Manipal, the Dadalpur.
विच लोकेशन
He's
फ्रॉम
Ma'am,
मैम
that is Dodaballapur from
okay.
Bangalore, I guess.
Okay, she is that
ओके
Okay.
Stinglicious.
Okay. All right. Nice, nice.
कांग्रेचुलेशन
Congratulations, Miss Anama. Right. So with this, we have learned. We've just come towards the closing part of Ivy Talks Gujarat Chapter July edition. So I would like to invite the closing remarks from our moderator, Ulas. Please, you can share your closing remarks, and we will also have Madhukuri ma'am in here. So we'll hear a little bit from ma'am also on the closing remarks, and just searching, we have Sarmishta ma'am in there. Okay, right. Ulas, you can start, please. And the
Sorry, ma'am.
feedback.
Sorry, I just lost the connection. I came.
No, 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 no.
Yes, ma'am.
Just for the closing remarks for the session, we are just about to conclude the session. So closing remarks quickly from the moderator's side.
Ma'am, I hope Sharmishta ma'am is there in the.
I am just trying to find ma'am only, because she was there. Not able to locate her right now. You can start. I'll just get ma'am in there. Okay.
Okay. So, on behalf of Infusion Nurses Society India Gujarat chapter, I express my sincere gratitude to our distinguished panels, Dr. Jyoti Patnagar ma'am, Dr. Mayur P. Patel sir, and Ms. Sutapa ma'am, and Akshay Kumar Varias sir. So it was really a proud moment, even for me, to mentor and to moderate the panel. So but I feel it was a great moment. And we will be continuing the same spirit till the November, when we will be rocking the stage during the INS conference in Ahmedabad. So thank you everyone, especially thanks to Pooja mom to continually inspiring us and to motivate us, and to the special thanks to always for Colonel Binu Sharma ma'am. To be always an inspiration to every one of us. And thank you, everyone. Thank you, as INS Gujarat chapter, and every chapter leaders, and every panelist, and every audience. Thank you so much. Over to you, ma'am.
Thank you so much, Ulas. I'm just trying to connect with Charmishta ma'am. I think we lost the connection with ma'am. One second. Yeah. So yeah, ma'am, it's just network area is not there. So we would just thank you so much. A lot of feedbacks are coming in. So guys, there is a feedback also which is there shared by Shinoj in the chat box. So we would request you all to please complete the feedback form, and that would be an sort of an attendance also for Ivy Talks. Also, you would be getting an email from our site with all the key insights from the panelist in detail on your emails, the same email where you have got the invites from the INS India. So, but this thing will exclusively only for the INS India members. So, to continue with IV talks and to get the expert insights, please, you can just join in INS India membership. You can take it up. The details are there with your nursing leaders. Mr. Vaman is there in the Gujarat, in Polymed Gujarat team. You can reach out to them also. To him also, he'll be helping you out to take it up. And I would also like to thank all the panelists like Jyoti ma'am, Sutapa ma'am, Mayur, Akshay. Thank you so much. And of course, Ullas for taking this entire session. Thank you all the audience for being there till the very end and to be a part of the quiz. Special thanks to Saranya for taking up the quiz program. It was new things that we have added to IV Talks. And of course, Vaman for taking this entire, holding the entire Gujarat chapter together. Last but not the least, Shamishta ma'am. She's not there, but yes, she is the backbone for the Gujarat chapter, and it's practically not possible to continue, without her support. So thank you so much, ma'am, and of course the IV Talks team, Ipshita and Shinoj. Thank you, guys. Thank you, all the audience. We would be catching up next week on IV Talks. Not next week, next month. It is going to be Tamil Nadu chapter. Please do join in. It's going to be pretty exciting. And yes, before closing, one special thanks to Sutapa ma'am for bringing in, Jyoti ma'am to the panel for us. Thank you so much, Sutapa ma'am, for all the insights from the beginning. Thank
Most
you.
welcome.
Thank you so much.
Thank you,
And thanks
everyone.
to Jyoti Patil ma'am also to spare time for us. Thank you so much.
Right.
Most
Thank,
welcome, everyone. Okay.
thank you, guys. See you next
Thank you.
time.
See you.
Thank you so much. It is my privilege to be with you people. Thank you so
Thank you,
much.
ma'am. Thank you.
Thank you so much. Thank you. Thank you.
Thank
Thank you
you.
so
See you
much.
in the
Thank you.
next IV Talks
Thank you.
in the month of August. Bye. Thank you.
Bye.
Thank you.
Bye.
Bye. Thank you, ma'am.
Have a great
Thank you,
day.
ma'am. Bye.